Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride. Welcome to Medical Media Mixer, the podcast. I'm Nicole Beniston, licensed clinical psychologist.
I'm Tara Prisco, physician assistant. So welcome back. Hopefully this is the third episode you're listening to.
Or if it's your first, welcome.
So we have to catch up because I know there's lots of random things because you had birthday shenanigans. So I want to hear.
Lots of shenanigans. So I was supposed to go to Atlantic City with a bunch of friends, and then some things happened. So I just ended up going with one of my friends, and we got bottle service for two of us.
Oh, God.
Which was a lot of
bottle.
I was fine the next day. I was very proud of myself. My friend, who is 13 years younger than me, was on the struggle bus for a whole day and a half.
Oh, geez.
So I'm glad that the old lady made it through.
Oh, my goodness. And then somehow prior to that, there was an elbow injury.
Yeah, I fell down my flight of stairs again. The same one I fell down that I hurt my shoulder 2 years ago. So, but I think I'm okay. I think it was just a really, really badly bruised elbow. So
okay. All right. No broken butts. No, we're good.
I mean, my butt is the one thing that's never going to break. There's too much padding back there.
All right. Disclaimer on my end. We are babysitting my in-law's puppy along with my own puppy, and he barks very sharply, and he is under the threat of throwing him out the window if he barks during this.
Not the puppy.
We love him, but his bark can cut glass.
Poor thing. What kind of puppy is he?
He's a toy schnoodle. We have a miniature schnoodle, which you met, ours is 24 pounds. He's 10 pounds. So the littler they are, that high pitched, but he's adorable.
Super fun.
We had lots of fun. We've been babysitting him for a week. My dog runs up. We have separate them because they're too wild together. They can only get minutes. And we have this enclosure pen thing, and they play through the pen, and he keeps putting his toys at the edge, and then she takes her paw, gets them to the edge, and takes them away and runs away, and he can't get them back.
Poor thing.
All right. Anything else new? Any other fun stories?
Yes. So someone who shall remain nameless, but is the other person not speaking right now, decided to post some stuff on social media without telling me. And my mother called me, and I could hear it playing in the background as she has it on the phone. And she says, "You two girls sound so professional. I just wish you both would have put a little makeup on and done your hair." And I was like, well, I didn't know it was going to be posted yet.
I figured it was a quick little clip of us who we are, and I was like, whatever. I didn't have makeup on either, whatever. Today I'm still in my work clothes, scrubs, whatever. I did put a little bit. You probably can't tell though.
I can.
That was at 6:30.
I meant to put on lipstick, and drink was a priority. So
6:30 in the morning. So I don't think the makeup's still there.
Mm-hmm.
All right, we ready to get into it?
I am.
All right, so my cocktail is purple-ish.
Ooh.
I don't know if it really looks purple, but
see it. Is it pea flower? I know purple is associated somehow. No spoilers.
No. So no, purple will be for the ribbon for this disease process.
Yes, that's what I meant.
Okay. I was like, huh? What? Pea flower? Sorry.
Yeah, pea flower is purple, and it makes a lot of drinks turn very purple.
Sorry, I don't know that fancy thing. So my drink was supposed to have blue curacao and grenadine to make it purple, but I realized that I had all the cocktail stuff for our next episode, but not for this one. So I winged it, and I used blackberry syrup, limoncello, and I used vodka, of course, and I used some food coloring to make it purple. But I'm going to tell you the drink I intended to do.
Okay.
Because that'll probably be brighter in color than this one. So it's called the Purple Rain. Credit to Tipsy Bartender, which is who I got this from. It's 1.5 ounces of vodka, 3 ounces of lemonade, half an ounce of blue curacao, 1/4 ounce of grenadine, sugar, and lemon. Shake it up in a glass or shaker, pour it in a glass. If you want to, and you're feeling fancy and you want to make purple sugar around the edge, you could do that with put the blue curacao and the sugar and like make the purple sugary rim thing. But I'm not that fancy.
Sounds good. Does it taste good?
Yeah, I mean, mine's a little different. Like I said, it's got the blackberry, but blackberry and lemon go together, so it works.
They do.
All right, we ready?
I'm ready.
This was my initial plan for like inspiration for this whole podcast was the TV show House. Because as much as it touches on a lot of crazy rare diseases, sometimes the way it goes about it is a bit off the wall.
Spoiler alert, Princeton Plainsboro Hospital is near where I used to live, and it looks nothing like the
right, because
hospital
it's
in
really
House.
just, well, it's Penn Medicine now, right? It used to be, its name was slightly different, but yeah, that's exactly who they're pretending it is.
Yep. And the pictures of that they do show of the hospital look more like Princeton University than the actual hospital.
Right. So, if we are really old and younger people are listening, I'll tell you about when the TV show House was out.
Oh my God.
It was out from 2004 to 2012, so that's a pretty darn long run. The whole premise is it follows a team of doctors that are led by this antisocial, painkiller addicted, arrogant doctor, Dr. Gregory House. And they specialize in diagnostic medicine. They refer to them as diagnosticians, which is not quite a real thing. We all diagnose, but basically they say it's very similar to Sherlock Holmes, sort of in the way that the episodes are laid out and sort of that aha moment that happens. And he loves solving puzzles, essentially. Lots of inappropriate way, like HR reportable behavior goes on. And, it was a fun show. I definitely watched it. So 2004, I would have just graduated PA school through 2012 before I had my first kid. So lots of TV watching years without interruption. So I definitely pretty sure I watched every episode. So the running joke on House on all these seasons is that it's always guessed that it's lupus because, like that's the rare disease they want to find. And it's never lupus in any of the episodes. So I'm going to give you a spoiler now because there's a whole lot that happens. But this time, it finally is. It's finally lupus. So this is season 4, episode 8. So like literally halfway into the series. So the running backstory on this really has nothing to do with the patient, but I'll give you a quick idea of the crazy antics that go on. So House is running a competition between candidates, which are like the fellows, I guess, to become his final team. The ridiculous challenge is that he has to obtain the thong of his boss, the medical director, Dr. Cuddy. Mm-hmm. Totally appropriate. As usual, one female doctor presents her own thong as the prize. Another one makes a deal with Cuddy saying, give it to me. And then you get to pick who gets cut from the competition. Lots of inappropriate commentary. There was a point in the episode where House is staring at his boss Cuddy's ass and saying, you don't have underwear on. If I did that to my boss, I don't know what would happen.
It depends on who your boss is, I guess.
Yeah, I guess so. And then just another little backstory, which we may touch on because it's a very interesting thing, is one of the doctors they call 13, her name. But in this episode, she's coaxed into revealing to House that her mother died from Huntington's. And this is a dominant inherited disease. So in the episode, essentially, House steals her water bottle to do genetic testing on her. So again, really appropriate. You'll just wait. All right, so let's talk about the patient. So 2 of the residents, or actually resident and fellow, whatever they are, Kuttner and Cole are at a magic show, and one of them gets to go up on stage to help the magician with his Chinese water torture chamber trick, where he's released down into this, not him, the magician's going down into this tank of water. He's tied up in handcuffs, the whole 9, and they realize that the magician's bleeding from his mouth. And he's like, oh, this isn't part of the act. So they pull him out, cut to, I guess they did CPR, but they just cut out from that scene. So we cut to presumably the next morning in the hospital. He convinces House to take the case on because the magician had a cardiac arrest just after entering the water. And the guy's a young looking guy, probably 30s. So that would be quite unusual. They agree to let him do the test, but he says he'll fire him if he can't find anything wrong. So they start discussing the case. They say his heart stopped. He lost consciousness after hitting the water. No history of heart disease, no angina. It happened too quickly. They do an echocardiogram. So in this, they do it themselves at the bedside, which now is sometimes done in emergent circumstances. But back in those times, bedside echo or ultrasound was rarely done.
Yeah, I would
Anyway,
think they wouldn't do it unless this person would be at risk if they moved them.
right. And usually it's much better done by a tech who actually does this all day and read by a cardiologist, not just by like this resident or fellow.
Well, we need the drama.
Well, yeah, you'll see. Like in this hospital, nobody works there but them, apparently. Like all these people in the background don't do anything.
I mean, I'm sure you felt that way at your job. I know I have in the past.
It's true. So they say he didn't have any shortness of breath or leg heaviness. He didn't have tightness in his chest of his arms. They say there's nothing, no valve problems. Everything looks good. The patient's actually acting fine. He's joking and performing tricks at the bedside, card tricks, joking with everybody. Looks fine. So not sure, other than the fact that he sort of died and got brought back, not sure why he's, there.
I should have asked you this before. Do you want me to play one of the doctors and start guessing?
Well, you can throw out some answers if you think you know.
That's a whole different podcast.
So then they decide they're going to send him for a TEE, which is a transesophageal echo, which they don't really give a reason why. Like if you didn't see anything on the regular, like why? So the reason we do TEEs usually is to look for something very specific that you can't see on a regular echo where the ultrasound is on your chest. Right. They actually go down your esophagus and echo that way. Usually we're doing that if we're looking for like typically like what we call a thrombus, which would be like a little clot, or something called left atrial appendage, or if we're looking for endocarditis, like an infection and you see the little infection on the valve. It's really all it's really absolutely needed for. So it's kind of random, but okay, let's do a really invasive test because that's what we do. And that was normal. They start talking about it and he says he can't find anything wrong. So of course, a foreman, he's like the sort of chief junior guy to House, says, let's do an MRI of the lungs.
Go for it, foreman. He's my favorite.
Oxygen leads to heart failure. And I'm like, okay, well, number one, heart failure is very different than heart stopping. Heart stopping is cardiac arrest. Heart failure is typically when you end up filling up with fluids in your legs, your lungs, you become short of breath. And that's because your heart muscle isn't pumping efficiently, which you would have seen on the 2 different echoes you did.
Right. And doesn't that usually take a little bit longer than just like suddenly how an attack or cardiac arrest could happen? Yeah.
Exactly. It's not sudden. It's like, I ate too much salt yesterday. Now I'm short of breath because I ate salami or whatever. That's my old patients typically. I ate hot dogs in the summer and now I'm in heart failure. So anyway, an MRI of the lungs, which is a very bizarre first choice. So, plain x-ray of the chest is always step one. CAT scan of the chest is the most commonly used. They use it all the time in the hospital.
And it's probably easier to get done.
Absolutely. So MRI, number one, is very expensive. And number two, it's tougher for a patient to go in. A lot of patients have anxiety about it.
It takes longer.
Yeah. I mean, it is used for certain body parts. Absolutely. There's certain body parts you have to MRI. It's a better test, but lungs are not that body part. Yeah. The only thing that really would make sense if it was someone who cannot have irradiation, like a pregnant woman, that would make sense. Obviously.
Maybe that's the twist. Maybe the magician's pregnant.
Wow. We need to pitch that. We need to bring the house back. So again, of course it shows really nothing, but they said that the reason they're checking it is because they're looking at the fungus in lung theory. Right. Because that's
Is that even going to come up on an MRI? Wouldn't you be able to? I mean,
you would see that on a CAT scan.
Yeah.
Or an x-ray. So typically, when we talk about mold or fungus, which that's a whole nother story again, all these things we need to talk about, but a lot of people are talking about testing them for mold. Most of the time, if you have mold exposure, it presents as more of an allergic / asthmatic type of a condition. Rarely you can get an actual fungal ball in your lung.
Sounds delicious.
I've actually had a patient who had this. And we were like Dr. House. My boss and I decided that biopsies were coming back negative. The cultures are really difficult to grow for fungus. Mm-hmm. She had mold in her office, this big ball on her CAT scan and her x-ray. Even the infectious disease didn't want to treat it. And this was like a 40-year-old woman, like had no health problems. So my boss and I had her sign something saying, you consent, we're going to treat you for this, even though no one wants to do it. And guess what? After however many months of treatment, fungal ball was gone.
Wow.
But that is the zebra. That is not the horse. That is the rarity. So anyway, not sure why they were looking for fungal stuff in his lungs.
Because
Of course
it
they
sounded
did.
sexy for the
Right.
TV show.
Right. So, but here's what happens in the MRI. So what can't you have in MRI?
You can't have anything metal in your body.
Right. So as soon as he enters the machine, he starts screaming bloody murder.
Oh boy. Does he have like a plate in his head or something?
So, they see bruising all over his abdomen and they're like, has internal bleeding, which actually is true. So bruising in your abdomen, something called Gray Turner sign. So this is what's cool about House, because they actually refer to all these real things. They just do it in such a very strange train of thought. So Gray Turner sign is a bruising. It's more likely like your flanks by your kidneys, but it's from basically hemorrhaging in usually the retroperitoneal space, which is kind of where your kidneys are, or bleeding, in that area. So it is a real sign. It's cool. They referenced it. But anyway, yes, he is internally bleeding. So they call surgery. They transfuse him. They cut to he's in surgery right now. So surgeons, doing the surgeon thing. House walks in. No head covering, putting his gloves on as he's walking to the open abdomen. First of all, if you've ever been in an operating room, that circulating nurse would have tackled you before you ever disturbed their sterile field. Like,
unless
for
you're
real.
House, and then come on in with your dirty ass cane and everything.
It was like, when I was a student, I was like deadly afraid that the nurse was going to yell at me. Like, you have to learn how to like get into the gown and how to glove in the, you know what I mean? Like, I was so scared. And he's like, just walking in, sticks his hand in the abdomen while the surgeon's there. He's not a surgeon.
Is there a glove on his hand?
Yes, there is a glove. And pulls out a key.
From his magic tricks.
He swallowed the key to unhook his, his chains and all that. So anyway, so the bleeding there basically is a red herring, had nothing to do with his actual illness. So he's back at his room. Again, just had open abdominal surgery. He's joking with House, playing magic tricks. And then his nose starts bleeding. Dun, dun,
just one nostril?
I don't remember. But like, have you seen this in TV shows? Like the dramatic effect of like a nosebleed, like being
where it's like, or someone looks down and there's drops in their hand or on the paper, and it's like,
right.
Oh no.
And so they say if his nosebleed that major means he must be sick. And I'm like, not really. I mean,
it's definitely a brain hemorrhage. It's 100% what it is.
Most of the time, nosebleeds, the fancy medical word is epistaxis. Usually it's from trauma to the tissue of the nose. Nose picking, dryness, which the heat and stuff right now is very famous for. Blowing your nose too hard. Sometimes intranasal drug use can cause things. Rarely, there are a couple times, but rarely is a nosebleed like the sign of like harbinger of death. Things to worry about if you're on significant blood thinners and you can't get it to stop. If you're under age 2, that's a little more concerning. If you have nosebleed and you're bruising all over your body, that might be a problem. Hemophilia, something, a tumor, whatever. So, but in general, not, like a big deal. Like he probably had oxygen on, like that dries out your nosebleed. But anyway, so then they start talking about more possible diagnoses. And I'm actually looking at my notes and I'm forgetting how they even jumped from nosebleed to this. Honestly,
they may not have explained. It may have just happened.
So they said, what if it isn't his heart, but the blood vessels around it?
Bum, bum, bum.
So what they're referring to is something called, they said it's classic polyarteritis nodosa. So that's a vasculitis. That's a disease that causes inflammation of the blood vessels and like necrotizing of those blood vessels. So necrotizing means tissue death. It's inflammatory, little aneurysms form, lots of not good things. It can affect the heart, but that is also the rarity. So most people have dermatologic skin lesions, gastrointestinal issues. About 60% have kidney issues with it. But really, cardiac is down there on the like really rare risk. So again, I wouldn't call that classic. But because they think it's this, they decide they're going to do a heart blood vessel biopsy. So that's interesting. They want to rule it out. And the other guy, Taub, says, no, I don't think it's that. I think it's cocaine. So they're going to split up the team.
Wait, hold on one second. This guy's been in the hospital for how many days and they haven't run a drug test yet?
Exactly.
I've been in the hospital for like an emergency room, and that's like the second thing they do is run a
Right.
drug test.
Exactly. But I guess it could connect things, nosebleed, heart problems. Logically, at least makes sense.
But still,
they,
that should have been like the first thing they ruled out.
Right. So they order what they call an environmental scan, which means they break into your house and look for causes of your disease, because we
That's
can do that,
real
right?
medical test, yes.
Right? Like I totally go to patients' houses and rifle through their belongings while they're in the hospital. So
I feel like they do that on multiple episodes.
Always, where they're looking for rat poison or rats or
rat droppings.
Right. All of it.
It's not the plague. Are you sure?
Right. So they're going to split up. So one decides they're going to do the cardiac biopsy. Now, typically a cardiac biopsy. Now, number one, I have literally in 20 years never heard this ordered or on a patient of mine. Now, it is a real test, but is typically done when they're diagnosing amyloidosis or they're looking after a heart transplant to look for certain things.
I would assume it's pretty invasive.
Highly. So it's usually done by an interventional cardiologist, not the random person who's still in training.
The janitor does it.
And even most interventional cardiologists will probably have never done this in their career. Like we're talking like high level tertiary centers. Like this is not normal. But anyway, yeah, they do a heart catheterization where they thread the little thing up and then they, through the groin or your wrist, through your blood vessels, snake it up to the heart. And then they use like a little device like forceps and they take a little sample and they send it off. All right. So let's see what the team at the patient's house is doing. First of all,
they are eating his food.
Well, what do magicians have as pets?
Rabbits.
Correct. They're like,
I'm getting all the answers right today.
You are. You win. They're like, it must be tularemia. Because they're saying tularemia, it causes pericarditis, explains everything. So tularemia is a real thing. It's an infectious zoonosis from Francisella tularensis. That's it. It's an aerobic gram-negative pleomorphic bacillus. It's actually one of the most infectious bacterial species, so it is highly infectious. It's carried in mammals, birds, amphibians, arthropods, but it's most known for lagomorphs, which are rabbits and hares. That's just like, I don't know why. Maybe they have more contact with people. I'm not sure why they've gotten the rap, but they do. There are a lot of different forms, just like we talked with the polyarteritis nodosa. Again, cardiac is like one of the rarest. So there's oropharyngeal, pneumonic, typhoidal, glandular, all these ones. And then pericarditis is listed as a rare. So, okay, sure. We think it's that. So they decide they're going to give an antibiotic, which is okay. I mean, I don't typically treat things unless you have a culture or something else like really supporting it. I mean, even a gram stain on his blood would tell us something, but sure. Let's throw antibiotics. So typically streptomycin would be first line. So I guess that's what they decide they're going to use. Cardiac biopsy comes back negative. They all kind of come back together and then the patient passes out. He's losing a lot of blood. So they decide, well, it must not be tularemia because he's bleeding. I'm not really sure how in this many hours they expected him to be cured of tularemia or not. I'm not really sure. So now they say cancer is most likely. Okay.
Again, blood testing.
Anything. So they prepare him for another MRI and the patient says he's going to die by that time tomorrow. He says, I'm going to die.
He's tomorrow. A psychic as well as a magician.
Well, so it's interesting. So have you ever heard of a sense of impending doom?
No, I've never heard of that as a psychologist.
No, well,
yes, I have heard about it. But I've also heard of like death predicting when people are very, very ill and they can tell that their time is coming.
So, it is a real thing. It is, and I've seen it twice. Like the look in someone's eye. There was just, I don't know, there's no way to explain it. I've read it in books, Sense of Impending Doom, until I saw a person like that fear in their eyes. It is real. But anyway, so they were theorizing that the sense of impending doom, might be right. I'm not sure how they get them a diagnosis though. They did do the MRI and he is having internal bleeding everywhere. So
I'm just going to jump in here for a minute. If I'm Mr. Magician and I'm in the hospital and this excellent team of doctors doesn't know what the heck is wrong with me, I'm going to be anxious.
A little bit.
When you have anxiety, you can have a sense of impending doom.
Correct. Sounds about right.
Just throwing that out there.
So, House dismisses all of these theories because, and he says it's no more impressive than him guessing all of their pagers might go off, like meaning the patient guessing his death.
Mm-hmm.
And then all of their pagers go off. It's kind of like a little silly thing in the episode. Kuttner thinks it might be tainted blood from the transfusions he got. So they say that the tainted
transfusions
blood
he just got like a day before.
Right. So
do they not test the blood in their bank in the hospital?
Exactly. Yes. So we'll get there. So it is true that acute, like a hemolytic transfusion reaction can cause a sense of impending doom if you are having, and a transfusion reaction from blood products can happen.
I just thought of something else. I would assume a sense of impending doom might have some physiological feelings as well. And if you're not healthy and feeling well, you're going to have maybe a racing heartbeat or difficulty breathing, which can be associated with a sense of impending doom.
Exactly. So, one theory is now we've split theories again, tainted blood. And then Foreman says that he sees the immunoglobulin levels are low and thinks it's amyloidosis, which we did mention about the cardiac biopsy, which was very negative, but anyway, so that is a real disease. It is when certain kinds of proteins called amyloids build up in your organs, heart, kidneys, liver, spleen, lots of things can happen. And that's because amyloids are important, but these are essentially what we call pathogenic amyloids. They are misfolded proteins, if that makes sense, and they are no good.
Yeah, that's associated with like dementia too. Amyloid plaques and
plaques. Right. So that's one theory. The other theory is the tainted blood. They go to see the patient because their pagers went off, remember. He's having a seizure, and they say, I guess because of his blood work, they see his kidneys are now failing. So they pull up somehow some paper records from the basement, because this is in those years where you have paper charts from 10 years ago. Which
I'm guessing this guy's been in the hospital at least 2 days and nobody got the chart yet.
Right.
There.
So they say going back 10 years, he's had joint pain and fatigue. So they're like trying to put that together with everything else. So again, they both go their different ways. So House thinks it's amyloidosis. He orders what's called a fat biopsy. And then the other three are going to go to the blood bank to look for problems with the blood itself. What's interesting, number one, is the blood bank has specific people whose job is to run the blood bank, and they have specific training for this.
Right. And this didn't happen in like the 1980s when they didn't check like blood as well. And there was like, this was happening in like late 90s, where there were more, 2000s. More things in place to prevent tainted blood.
Yeah, I mean, so blood bank, they process the blood. They do test it for not just diseases, but they have to test certain markers. We know blood types, right?
Mm-hmm.
So ABO, blood typing, and then the RH is the positive or the negative.
Mm-hmm.
And they also screen for certain antibodies because some people will react to that. It's a foreign substance, a foreign body. And so sometimes if there's a mismatch there, you could have a reaction. They look for hepatitis and they look for HIV. They also look for syphilis, apparently Chagas disease, and West Nile virus, and HTLV, human T lymphotropic virus, which I don't really know much about.
Fun.
So somehow this team, again, is there in the blood bank, checking the blood with no staff that actually work in the blood bank. It's very dim in the room, too. It's very strange.
They don't want to expose the blood to light.
Okay. Because they're vampires?
I don't know. Because it's more dramatic that way.
Yeah, it's just a very strange thing. So they can't find any problems. The fat biopsy apparently comes back inconclusive because biopsies come back in 2 hours because, the pathologist is just sitting there waiting for your biopsy. They said they can't do blood cultures because there isn't any time. So House says, let's just treat for amyloidosis because we're going to treat for the thing that we don't think it is. But anyway. Foreman stops him, says it's too dangerous, even though he's the one who actually said amyloidosis in the beginning.
It's too dangerous. Wait, never mind. I didn't say that.
And then here's the real twist, which House decides, give me the blood. I want the blood transfusion. I'm also type AB. We'll see if there's a problem with it by giving it to me. I don't understand. I have no concept of how that helps.
It doesn't.
So, yeah. So the resident is actually hanging the blood herself. Again, there's people trained to do this. And hanging out in the office with House while he gets his blood transfusion. Again, We don't give extra blood to people who have enough blood.
I was just going to say that. If he doesn't need it, if he's not lacking blood,
Yeah, that
like
too
your
much.
body can only hold so much, right?
Right. Too much is not a good thing. There's actually like disease called polycythemia when you have too much blood. Like it's not a good thing. Like it can cause clots and things.
Everything in moderation.
Blood, cocktails,
alcohol,
purple especially.
water.
My tongue's not purple yet from the drink yet,
Not
so
yet.
that's good.
Drink more.
So of course, House starts sweating while he's getting the transfusion. He's burning up. You know, is it a blood transfusion reaction? This is, again, as we talked about a little bit, your immune system reacting to something on the blood. Even if it's partially not compatible with you, sometimes that can happen. In each transfusion you get, you become more sensitized and can have more of a reaction. So I'm not really sure what this has to do with the patient, but they said, now we're going to do a biopsy on House.
It has to do with all of that morphine that he's been using on the side that we find about next season.
Yeah, he's just going through withdrawal. That's the sweating and the fever.
Exactly.
So they said, we're going to biopsy House because we can't biopsy the patient because he's going to hemorrhage. Again, but I don't know. So House says, I'm fine. And then he stands up, he feels dizzy, and then he realizes his coffee has been spiked by the residents so that he can get knocked out so they can biopsy him. So cut to a procedure room. There's no anesthesiologist, no nurses, no staff. They're doing an ultrasound guided biopsy. The resident 13 who's doing it is drinking a water bottle while she's doing it. That's totally OSHA compliant.
Are you sure? I'm pretty sure you're allowed to have any sort of drinks you want during any sort of medical...
Over an open biopsy, right? Yeah.
So, I mean, if it's alcohol, it's just going to clean it out.
So apparently they biopsy his lung and his kidney already while he was out, but he wakes up and his arms are tied down. And he asks if the patient's still alive. And then she proceeds.
That's his first question.
I guess she's mad at him about the whole Huntington's thing. And she proceeds to do a liver biopsy without lidocaine on him while he's awake.
How did any of these people get licensed?
I don't know. So his biopsies are clean because, again, he's not the patient. So they decide, well, we're treating
a drug addict. So in theory, his biopsy should not be clean.
Well, yeah, not clean in that way. So Wilson, who's just another character, is House's good friend, who's a hematology oncology.
He's not just another character. Wilson is the hero of House. Have you not watched it?
He's his conscience, essentially.
Exactly.
He's his Jiminy Cricket on his shoulder. So he tells him, in order to treat the amyloidosis, we have to irradiate the patient to do a bone marrow transplant. There are drugs available, but this is the choice of which treatment. It is an actual viable treatment. And while they're talking about it, and House and Wilson are chatting, of course, boom, the aha moment. House, he's processed everything that's happened and he's
connected all the red strings.
I've got it. So he says the patient isn't dying. He was given the wrong blood type AB instead of type A. That's why he got worse immediately after his surgery. And it also explains his earlier heart attack. He was making antibodies that didn't match his blood type because he has an autoimmune disease.
Dun, dun, dun.
Drum roll. I can't do a drum roll without making bad noise on the microphone. Lupus.
Well, okay, hold on. There are multiple autoimmune diseases.
Correct.
He jumps right to lupus.
Well, as far as making weird antibodies lupus is the thing that masquerades as everything and nothing all at the same time. So I do get it is very tricky. So basically they're saying that the test picked up the extra antibody that his body was making instead of his actual blood type, like type A. He tested as type AB. And the wrong type of blood caused the organ failure and the bleeding. So he says, give him some saline, some type A blood, and some prednisone.
Was it the anti-ribosomal P antibody?
Well, that is one of the ones we check when we check for lupus. That is one of the blood tests
we check. It was in my notes.
Yeah. So just quick on blood types. So like we said, there's A, B, O, and AB. AB being the most rare. O positive, so each of these gets a positive or negative, is a universal receiver. O negative is a universal donor, right? Yes.
Mm-hmm. I guess. I don't know.
I guess AB is super rare. If you have AB negative, go donate blood. They need it. I mean, everyone to donate blood, but
No, not everyone.
No, I messed it up. I'm sorry. AB is the universal receiver. I don't know why I said O, but anyway. So the wrong type can cause what's called DIC, which is it's like a clotting and bleeding cascade. And the autoimmune disease basically can make the antibodies go haywire. So I actually found like a little study that did mention a case presentation of a real patient with this actually happening. It was a 26-year-old woman presenting with systemic lupus erythematosus. And this paper was by Norio Nakamura and colleagues as being a result of anti-gluten to anti-B antibodies and a false positive result. It is really documented in the literature, obviously not a common thing. So what is lupus? You know, we covered a lot of diseases, a lot of craziness. So I'm not going to go deep, but we'll give you some basics. It's a disease when your body's immune system attacks your own tissues. So again, hence the word autoimmune. It causes inflammation, and that inflammation can affect your joints, skin, kidneys, blood cells, brain, heart, and lungs, among other things. So when we say the word lupus, the most common type is what we said, the SLE, systemic lupus erythematosus. That's what we usually call lupus. There are other forms. Cutaneous lupus. Do you know who has cutaneous lupus? Very famous singer.
It's probably the singer I'm going to talk about.
Cheeks.
Selena Gomez.
No, she has lupus. Yeah.
Yes. Well, I'm going to talk about her.
Seal.
Oh, yes.
The scarring on his face?
Well, I thought they were saying that the scarring on his face was from some tribal thing. Like, I know that was a rumor for a while, and then he said that wasn't what it was, but I don't know for sure.
It's cutaneous lupus. There's also drug-induced lupus, where a medication can cause it, and then neonatal, which obviously isn't true lupus, but it's sometimes when a baby's born to a mother who has lupus. So SLE is the most common.
Can I give you a fun fact about lupus that you probably won't say?
Oh, sure.
About why it's so lupus comes from lupin, meaning wolf. And It's because back when it was first being discovered, the rash associated with lupus looked like a wolf bite or a wolf scratch.
Got it. Yes, I get the word lupine, but I didn't. Yeah, cool. So mostly affects women because, you know, autoimmune diseases love women. Mostly in these young to middle ages, 15 to 44 years old. Some ethnic groups are more effective. So Black or African American, Hispanic Latino, Native American, and Native Alaskans, Asian Americans, and Pacific Islanders. Someone who has a family member with lupus or another autoimmune disease is going to be more at risk. You can have skin rashes, pain or swelling at your joints, swelling in your feet or around your eyes if your kidneys are affected, extreme fatigue. One of the big complications that we worry about is lupus nephritis. So that's kidney disease from lupus. And actually, my aunt passed from this when I was only 2 years old. And she was only like 20 something when she passed. Yeah. I mean, this was in 1982 ish. So I guess they didn't have the therapies they have now today.
Yeah. Or maybe they didn't catch it soon enough.
Yeah. I'm not really sure. I was a baby. So.
You don't remember? Come on.
So I'm sure the big thing you're going to talk about is neuropsychiatric lupus.
How did you know?
I'm not going to talk about that at all. There's child onset or pediatric lupus. It tends to be more serious, and refractory is basically when you can't get somebody in remission. And there is here, I guess this is under refractory. Some of the things that can happen: high fevers, seizures, behavior changes of the blood vessels in the brain. You can have heart attacks, rashes, sores, and ulcers. And then the most famous, the skin rash you were referring to, is called the butterfly rash or the malar rash, and it's on your cheeks. And specifically, it spares your nasolabial fold, which is that little line between your nose and sort of your mouth. So that's lupus. There's a lot of treatments out there. See a rheumatologist and get some good treatment. And that's it for me.
Well, guess what I'm going to talk about today?
I wonder.
Also lupus. But I actually watched two different things about lupus because spoiler alert, listeners, we did discuss that we would be talking about this today just because I knew there was a lot of mental health connections with lupus. And so I felt like it would be good to have our episode talk about the same things. So when I started researching TV shows, films, things like that to watch, I saw a lot of recommendations for a movie called Beyond the Universe. So that is a movie. It's on Netflix. I'm sure you can also get it elsewhere. It came out in 2022, and it's a Brazilian drama about basically the experience of having lupus. And it was, honestly, I sat down and I watched it, and it was beautifully done. So the plot, I'll go over really quickly. There is a woman. She's a very talented pianist, but she wants to join the symphony orchestra, and she goes to audition at like 13 years old, and she collapses on stage during like a significant recital. And then afterwards, she's diagnosed with lupus. Oh, wait, before she collapses, looks down, blood dripping. Look at that connection.
Dramatic effect.
Dramatic effect. So then it fast forwards to several years. She has lupus. She's been undergoing treatment, but at this point, her kidneys have been so damaged that she has to be on a kidney donor list, and she has to go to multiple hours of dialysis multiple times a week. And when the doctor tells her like, hey, we got to put you on the donation list, like there's like 14,000 people ahead of her. So she's kind of like, I'm probably going to die from this. So she gets really depressed and doesn't really want to do much. And she decides that she's going to go to her dialysis and kind of continue to do the treatment she's been doing for years. And as she's going to the hospital, she sees a poster that the São Paulo Symphony Orchestra is going to be looking for a new soloist for piano. And so she's like really excited and she wants to practice and participate, but she's not really sure. And so we find out through the course of that plot line that she'd been working part-time at a music conservatory, and she's doing tutoring on the side and things like that. But because of her illness and some of the fatigue and joint pain and things like that, she hasn't shown up consistently enough. And so they're basically like, look, we might have to fire you. So now she's like, okay, now not only do I not have a job, now I have nowhere to practice because she doesn't have a piano at home. So as she's walking to the hospital, as one does when they have a severe kidney problems, they walk to the hospital. And I have to preface this by saying it doesn't appear that her family's super rich, but they're also not like in stark poverty. Like if she was really that sick, I'm sure somebody could have given her a ride to the hospital, but whatever. It's for plotline effect. So she's taking a shortcut through the train station, and there's just a piano there in the middle of the train station. Like, sometimes you're at the mall and there's a piano, stuff like that.
Airport.
Yeah, airport. So she sits down and she starts to play. And as she's playing, this guy is riding his bicycle and crashes right into the piano. And, they have a little like, and, that's it. Of course, they're both very beautiful people. The guy on the bike is hot. She's gorgeous. We know there's a love connection coming about. So she goes on to her treatments and whatever, and she's at the hospital, and guess who shows up as a doctor? It's Mr. Hot Guy. He's a resident at the hospital, and there's a little, kind of comedy of errors, but they stumble across each other. And Gabriel, he is the resident doctor. He tells his fellow resident and BFF that, he saw this hot girl at the train station and now she's here. And so then they start talking and flirting, and fast forward, now they're dating. And his best friend, who's also the resident, Yuri, is like, dude, like Hippocratic oath, like you can't do this stuff. And he's like, whatever, I'm gonna do whatever I want. Then we find out, guess who the like head of the hospital is? Gabriel's dad.
Oh.
So now he's going to get in trouble for this whole thing with Nina. Nina is her name. So, of course, throughout it, we're seeing like all of her struggles with her dialysis, the difficulty that she's having with her lupus. She has like the facial rash that on and off throughout the film. Her joint pain makes it really difficult for her to play the piano, makes her difficult for her to do things. She only mentions offhand, very briefly, but that she can't go outside in the sun, which photosensitivity I know is a symptom. I guess due to the level of her lupus, like she literally does not go outside at all unless it's nighttime. I don't know if that's for dramatic effect or what.
Some of the medications also can make you very photosensitive.
And that's funny. They don't really talk about any treatment that she's getting other than the dialysis. I'm sure she's getting other treatment, right, but still. So she's struggling. She gets to her first audition for the pianist for the symphony orchestra. And at first, she stumbles on the keys and messes up, but then she rallies and plays beautifully. And she gets to move on to the second audition. I think it's a series of 3 auditions. Meanwhile, her and Gabriel hit in the club, drinking, dancing. And I'm just like, girl, you couldn't get out of bed this morning and you couldn't play the piano in this recital you've been dreaming about for years, but now you're hooking up with hot dude in the club. So whatever. She does make a comment at one point that she doesn't drink. But then later on you see her drinking something. Maybe it was non-alcoholic. I don't know. So anyway, they're hanging out, they're partying, whatever. She goes to her second part of the recital and she's playing and she gets up to take her bow and passes out again. Meanwhile, Gabriel was supposed to watch her second recital and dude was late because dad found out about their relationship and punished him by making him do like extra residency hours, because that's how it works in the hospital.
Of course.
at least in Brazil. That's how it works.
Oh, yeah, we're in Brazil, so they don't have the 80-hour work week cap
I don't know.
that we have here.
Who knows? There's a lot of dramatic effect in this movie, but it's also a very sweet movie.
And that's why they're beautiful, because Brazilian people are really beautiful.
I mean, yes, there's not one ugly person in this movie. They're all hot. Like, even like grumpy old dad, who's like the director of the hospital, like dad can get it too. So as she's collapsing, Gabriel's rushing to get to the audition because he promised to watch her play, and he gets into a bike accident. Yeah, just,
he likes to run his bike into things. So.
He does. And he gets into like a pretty significant accident. Like when he finally shows up and they're taking her out in the ambulance, like he's got like a gaping head wound and is like bleeding. And he's like, nah, I'm good, guys. And they're okay. And then he just goes back to work with a gaping head wound, but whatever. So she's in the hospital. She's, getting worse. Her kidneys are almost completely in failure at this time. And she's kind of just like, well, forget it. Like, I can't do anything now. She stays in the hospital for a while. They discharge her home and she's kind of just resting at home, really upset, not like feeling great about stuff. And then she finds out that Gabriel could get in trouble with his dad and lose his residency. So she's like pushing him away. No, I don't love you anymore, because, she's trying to save him, whatever. And then one of her friends that she meets in dialysis is like, girl, you dumb. Like, he's hot. Like, save him, be with him, whatever. So, trying to rejoin the love connection.
I have a question. Are there subtitles, or are they speaking English?
It's dubbed over in English.
Oh, okay. Just because like the drama and all that, I'm trying to picture it.
Yeah. And then basically they get back together. He does this beautiful, so there's this one little part in the movie where there's a chapel in the hospital and there's an old dusty piano in the chapel and he dusts it off so she can use it to practice. So then like when he wants to get back to her, he like decorates the piano and candles and flowers and invites all of their friends to come watch her play to practice. And it's very romantic and lovely.
Very sweet.
So then he also invites one of the, I guess, directors from the orchestra who like saw her collapse at the audition to like see her play now, because now she's just playing for the joy of it.
Right.
And so this person is like, oh my gosh, you were amazing. Like, I'm going to let you have another audition. When you're healthy and you feel ready, you come on in and we'll do an audition. Then Gabriel just like decides to go on a hiking trip out of nowhere. And there's a backstory. His mother had died when he was young, and they used to go hiking at this place together, and it means a lot to him. So he goes on the hiking trip, but he gives his mother's necklace to Nina to protect her and to wish her luck on her audition. And so she goes to the audition, she plays beautifully, does well. At the end of it, she gets like this weird feeling, and then we find that on the hiking trip, Gabriel falls off a mountain.
Yeah. Oh my gosh.
Yeah.
Gabriel, no.
Yeah. So
that was a shock. I did not expect that.
Gabriel gets rushed to the hospital. He dies.
Wait, he was alive at first?
Yeah. Yeah. He gets rushed to the hospital. I mean, he's in bad shape, but he's not dead yet. Gets rushed to the hospital, has a subdural hematoma, and then dies on the operating table. So during all of this, Gabriel was also doing some way unethical stuff and trying to donate one of his kidneys to Nina, but he wasn't a match.
Okay.
And then at some point, his father finds out about it and was like, wow, like not only are you willing to sacrifice your job, you're like trying to give up a kidney for this woman. Like she must be something.
Right.
So after he dies, Dad and Nina like meet like more. Like they've met in passing, but like they like have like a heart to heart and they grieve together. And he donates his kidney to Nina. Dad.
Okay.
Yeah. And then end of movie, it's a year later, she's doing great. She's like head of the symphony orchestra, and now she's singing. Apparently they sing in orchestras. She sings a song that she wrote for Gabriel. So that's the movie. Okay. So what I'm going to talk about with that is just really brief, just kind of talking about some of the psychological and social difficulties associated with lupus or any chronic disease. So like you said before, chronic pain, joint pain, which can cause gross or fine motor issues, fatigue, headache, brain fog, like cognitive difficulties, the rash, like you said. There's also, you kind of alluded to, increased risk for seizure or stroke due to all the inflammation and problems associated with it. Having to avoid sunlight, and then the side effects of treatment. Like you might have restrictions from treatment. You can't do this, you can't do that. Your diet might be limited. And then the other issue that happens with a lot of people who have chronic illnesses, your illness can be exacerbated by stress. So it's really hard to live a stress-free life when you have chronic health problems all the time. And then also the other things like people not understanding, like, oh, you look fine. Like you don't look sick. Everything looks fine with you. Or, oh, you've just got some sunburn on your face. There's nothing wrong with you. How that can be really stressful to deal with when you're really struggling internally.
The invisible diseases.
Exactly.
Yeah.
Which we could do multiple episodes on that
Yes.
stuff.
Yes.
And then just how that impacts the ability to work, to socialize, to do other enjoyable activities, even if you're not going out on the town or things like that. And then the stress that can come with like not getting an initial diagnosis. This movie, you didn't really talk about. I think a lot of people don't talk about how long it takes to get some of these diagnoses of lupus, of any type of autoimmune disorders. It can be a very long time before people are officially diagnosed and coping with these health issues that whole time. And then just the emotional burden of knowing that this is a lifelong disorder that you're going to have, and you're always going to have to take medication or do things like this or treatment unless you get a transplant. My understanding is even if you do get a transplant, you still have to be careful and be at risk, or there's just different complications after you have a transplant.
Absolutely. So, I mean, it doesn't take away the lupus, it takes away the kidney issue
Failure,
part, right? And then with any transplant, you're going to be on suppressive drugs to suppress your immune system even further so you don't reject the kidney. So there's a whole lot of risk that goes along with that.
Yeah. So that was mostly what I was thinking of when I was watching that movie, just how this woman's life in so many areas was impacted by her lupus. And then the other film that I watched was Selena Gomez, My Mind and Me, which is a documentary about her, which I feel like it was advertised to be about her lupus, but it's really more about her mental health issues.
Real quick, did you see the news today? She got engaged?
That she's engaged? Yes, of course.
Yes.
Go Selena.
It just happened to be on today. That's so cool.
Love you and Benny. So happy for you both.
We do the old school. We do the old school.
We do the
heart.
old school heart. I don't
know what this new one that the kids do, like some weird hearts. I don't know.
Yeah, I don't know how to do the new ones. The old school heart's way easier for us old folks with arthritis and finger issues. So I was going into that documentary. One, I just love Selena. So I was like, I'm going to sit down and watch this. And it just happened to be homework for the podcast. And I thought it was going to be more about the connection of lupus and mental health issues. But she really focused more on the mental health issues, which is fine. And I think it's appropriate. But after watching it and working in the field, I feel like it was a little misleading for people because she talks about how, she had been inpatient hospitalized and then was diagnosed with bipolar and things like that. And I just feel like, and maybe she wasn't educated on the connection that the lupus is causing some of this versus having the two separate things. I think the other difficulty in the field of mental health is whenever somebody has an underlying medical condition, we're still calling it what it is. We're calling it bipolar, due to an underlying medical condition. We're calling it this due to that. And so on the surface, other people are just going to be like, oh, you're just bipolar, you're just crazy. There's more to it than that. So I was going to talk about neuropsychiatric lupus, which is very rare. So first and foremost, I want to talk about the Lupus Research Alliance said that in people who are diagnosed with lupus, so these are people who are already diagnosed and know that they have it, about 25% of them experience depression, 37% of them experience anxiety. And of those people who have mental health issues associated with lupus, it said 80% can have neuropsychiatric lupus. I don't know. I feel like that number sounds misleading because it sounds like 80% of people who have lupus have it, but I think it's 80% of the people who have severe mental health issues from lupus. It is the neuropsychiatric.
Got it. And what's the definition of severe versus moderate? Like there's
exactly. Yeah, it's not clear, but they're the Lupus Research Alliance. I'm sure if I dug a little deeper, I could find more details, but I was just kind of, hitting the bullet points from them. In general, lupus can cause and exacerbate depression, anxiety, executive functioning symptoms, memory and cognitive problems, and sometimes mania. So just kind of the up and down. I don't feel like it's the traditional mania that we think of in bipolar. I think it's more of the shifting from depression to anxiety and back and forth. And the way those symptoms tend to be treated and, just the general depression and emotion of dealing with a chronic illness is medical and psychiatric. So they're going to give you the meds to try to maintain the disease of lupus. They're also may, if you need, prescribe general medications for like antidepressants, anti-anxiety meds, things like that, and really focusing on increasing quality of life. Because we do know that anyone who has any sort of chronic illness, the more hopeful they are, the better their quality of life, the better they do with the illness. So that's kind of just, the things that we've all heard of: yoga, meditation, relaxation, deep breathing, exercising, rest, journaling, social support, music, kind of all the things that we would suggest for any mental health problem. It's going to work for lupus associated psychiatric symptoms as well. But neuropsychiatric lupus is a different animal. It's very rare, and it tends to happen for some reason within the first 3 years of diagnosis, which I find odd because, like I was saying before, not everyone is diagnosed right away. So it's like, well, how are we tracking that?
So it could be even a presentation of the illness,
Yes.
which is really, really tricky then.
Yeah, because then people are looking more at the psychosis because, as most people can imagine, psychosis is very scary and most people want to contain it and reduce it as soon as possible and not necessarily look at the other factors involved. So just like regular psychosis, neuropsychiatric lupus or lupus psychosis can include hallucinations, delusions, confusion, speech and thinking problems, changes to mood and personality. And so basically, why that all happens is the inflammation associated with the autoimmune disease. In these cases, that inflammation may be occurring in the brain tissue and then causing this change in behavior and causing things like hallucinations and delusions, things that were not there at the person's baseline. However, and so like I kind of said before, that inflammation can also be connected to increased levels of antibodies or certain proteins in the brain that cause even further inflammation. So it's not just the general inflammation that may be happening from the lupus, but certain types of things are kind of going haywire and then traveling to the brain or just manifesting in the brain. But there's also been a lot of research that showed that corticosteroids can cause psychosis. And that
Absolutely.
and that is kind of the frontline treatment for a lot of autoimmune disorders, especially lupus. So it's kind of like chicken or the egg, which was happening first.
Absolutely.
But at least it seems like there's a lot of knowledge in the field of neuropsychiatric lupus that, let's try changing the treatment first and see if that gets rid of the symptoms. If not. The good thing about it, though, with neuropsychiatric lupus is that it has a very good prognosis. So there was a study, I believe it's in 2021, but it was an international study that I think it looked at like 1,200 people, maybe more than that. I have it somewhere, but I'm going to talk about the main points of it. So basically, of these people, and all of those people had a diagnosis of neuropsychiatric lupus. So they had lupus and then they had this event, and that's kind of how they're talking about have a psychotic event. The large majority of them only had one psychotic event. And then it was very, very rare for someone to have two psychotic events. And then I think it was like less than 2% of those people had more than two events. I think it was 3 was the max that they had seen. And all of those people were treated appropriately. So they knew they had the lupus. They knew that it was the psychiatric symptoms were related to that. And so they were getting the appropriate treatment because they were already seeing a specialist in a lupus center or an autoimmune center. So what they found was that when those people were treated with antipsychotics, prednisone, methylprednisone, some other things like that, that 66.7% of them, their symptoms completely resolved once they started that treatment.
That's wonderful.
Yeah. So that's showing that really is, it's the lupus that's causing it. Like it's not something, it's not a predisposition to have schizophrenia or psychosis or things like that. It is this disease is causing these symptoms, and these symptoms are more part of the autoimmune disease versus something on their own. It didn't say what happened to the other 43.3% of people, but I can imagine in like a lot of studies, maybe people did not follow up, things like that. Anytime we do any sort of studies on people, we get a dropout rate or things like that. So sometimes it's hard to track the entire 100% afterwards. So I forgot to talk about my cocktail.
Oh, yeah.
The cocktail that I'm actually drinking, which I had to kind of jerry-rig myself. So I was looking at cocktails that are anti-inflammatory because, we want to reduce the inflammation to help treat lupus or any autoimmune disorder. Or, all of us can benefit from anti-inflammatories. So the one that I'm drinking is called a sparkling strawberry ginger lemonade. I was missing one ingredient. So it is supposed to have, where's the recipe? Jump to recipe. I don't need to know the story of strawberries. Okay. So it's supposed to have whole strawberries, sparkling pink lemonade, ginger beer, and then mint for garnish. I just didn't have ginger beer, so close enough. But it's very tasty. I'm enjoying it. And then I actually found an alcoholic cocktail, ironically, because alcohol can cause inflammation.
Right.
But this one is called the anti-inflammatory. And I think it's called that because it contains turmeric, which we know can reduce inflammation.
Yes.
So and that is a shout out to liquor.com for the anti-inflammatory cocktail. It's 1.5 ounces of cognac, 1.5 ounces of turmeric infused coconut milk, which I would imagine coconut milk probably helps with inflammatory stuff too. A half ounce of honey syrup, and then garnish with chili oil and cilantro. That sounds good. I don't think I do the chili oil part, but the rest I'm down for.
Sweet and spicy.
Yeah. And then, the sparkling strawberry cocktail was from eatingwell.com.
Nice.
Yeah, so that's all I had for neuropsychiatric lupus, mostly because it presents very much like regular psychosis, so there wasn't really anything additional to add to it. But I will say, in the documentary, it's kind of brushed aside, but Selena did experience a psychotic break and was hospitalized for a couple of months. She was having hallucinations and delusions and was suicidal. And that was in the middle of her last tour. And so her tour had ended. And a lot of people were saying that she was in treatment for substance abuse or for eating disorders or things like that. But she had actually had a psychotic break.
Yeah,
and she does talk very openly about that, which is very brave of her.
Yeah, I mean, being in the spotlight like that and then having these complicated conditions, and I can't even imagine all that outside, what people are saying, and it's so hard. But I do love her, and of course, we watch Only Murders in the Building, and I have my kids watching the original Wizards of Waverly Place.
Well, I will tell you, if you watch this documentary, Selena does not like to talk about wizards at all.
So what's interesting is there's a new one, a modern one. She makes a cameo in the first episode. It's about the brother and his kids. So we were watching a little of the new one, a little of the old one. So I don't know, like, the deal with that, but she did come back for a cameo.
She did. And I don't know either, because it's funny. In the documentary, she's kind of reflecting on her life in the spotlight, talking about Barney and things like that, which she always speaks about Barney with, like, mostly positive comments. You know, it's hard to be, you know, a 6-year-old and working full time, but like, she does speak about it in a relatively positive light. But there's one point where someone asks her, and in like an interview, and she gets really upset. And then after the interview, she's like, I'm dressed like a fucking witch. Everybody thinks that that's just me and that's not me. So I feel like there might be some trauma associated with that. I don't know if it's on the personal end that was happening while she was on the show or what, but she definitely has some difficult feelings around that show. And then she talks a lot about just being in the spotlight and how hard it is. And there's one scene, which you've probably seen because it was like on TikTok, it went viral, where it's her and her best friend, and they're in like a hotel room. And Selena looks like exhausted. Like, she's just sitting there eating her breakfast. And her friend is like, oh, do you want to do this today? Do you want to do this? She's like, no, I'm just tired. And then her friend's like, well, why are you being so like mean? And like, it honestly, it makes her friend look like kind of a bitch. But if you watch the whole context of it, her friend is really just kind of like doing a check-in, like, are you okay? Like, what's going on? What, you're acting differently. And that scene happens. She had just taken a vacation to Kenya and had a really relaxing time, really kind of got to reconnect with herself and her goals and her passion. And I think what seems to be happening is that she's getting kind of anxious about having to go back to, you know, the hectic life that she's in. And then she's sad, you know, she wants to be able to relax and live that life, but she knows that she can't. And she knows that if she wants to help those people, that she needs to live this current life. So she's kind of torn.
Oh, yeah. Well, we like her. So
we love
shout
Selena.
Out. Maybe she'll listen to us one day.
Oh my gosh, Selena, if you listen to this, all my dreams. Now all we need to do is get Brittany to listen, and I'll live a happy life.
I mean, you could do an episode of her documentary, but I'm not sure if that'd be positive or negative.
There's a lot to unpack, but Brittany, I love you. And if you need an individual therapist, please give me a call.
All right. I think that's episode 3.
Yeah, we did it.
Okay. We have real social media now, even with or without makeup. So we have an Instagram page, Medical Media Mixer. We have a TikTok page, Medical Media Mixer, and we have a YouTube channel, Medical Media Mixer Podcast. If you look for our logo, it's sort of a black background with like purplish pink writing and a little martini glass in the middle. That's us.
Yeah.
Come follow us, and definitely, please rate,
review, and subscribe.
Podcast. Yes. That too. Yes, subscribe though. The more downloads we get, the more it kind of pushes us up in the algorithm and gets us out there for more exposure.
Yes, and tell them about our email address so they can send in ideas if they want us to talk about things.
Yes, medicalmediamixer@gmail.com.
Oh, I could have told them that. Sorry.
Yeah, it's super easy.
Someone got on top of getting all those domain names right away.
I was just trying to like get it done because I was afraid that like while I had the time, I better do it. So we're out there.
Facts.
Follow us, and hopefully we'll have more episodes to come.
Yay. Thanks, guys.
All right. Medical Media Mixer, the perfect cocktail.
Cheers.
Cheers. Clink.